Okay.
And, I do the family plan program and, total fast. It does, yeah, it does.
So I used to.
Yeah.
That was good, right?
I know it's fine.
Skylar, yes.
Well, we're landing here.
So you wanna laugh, because it says top shelf. So that's why I declined you the first time. Because I wanted to see, there's one of our best friends
More chairs.
died last Friday, very unexpectedly. And so, the girl.
I read her 10
Where they're getting together.
I tried to get
Oh,
her.
okay.
And I would
She's
like to
gonna
go
move
to
the
the
comments
girl.
live stream.
Yeah.
7210.
Go check her internet levels, your computer, can't use her APAC.
Yep.
I haven't had my boots here. I had my boots here the other day. And, I've been trying to. For about 4 weeks.
No, I started at 2, so I just thought
Right
about
now,
it.
and so I decided not to do it. I'll answer with this. So, thank you.
Okay, all right.
So this says Untitled Chapter.
Yeah, well.
Yeah.
And I have the high.
I never get.
And I didn't get sorted.
Well, good to visit with you.
Well, please come call like that.
I will do that.
Thank you. Okay.
Okay, bye-bye.
And they're not seeing my findings.
Oh, I'm getting your Google stuff.
The girl like scheduled this appointment today at the health department. She said
to mirror it to pretty much exactly what we have currently. So hopefully you haven't been in a panic since you've received the mailer. And we have the representatives here for Blue Cross Blue Shield. We have some Silver Sneakers people here. We have Blue Cross Blue Shield here, so if you have questions, prescription drug people are here. We should be able to answer anything that you have today, all right? So with that, I'm gonna get ready to turn it over to Tracy. She is with, Liz, do you want to take over first? I'm gonna turn it over to Liz again.
Yeah, so hi, welcome everybody, and thank you for coming today to the review of the county variance plan. We hope that you find the information very able to answer any questions that you have, so we'll take all the time that we need to answer your questions. I just wanted to give a huge apology on behalf of our organization. We did have an error in the packet that you received, and it created some concerns, and I really, my apologies are to Amy and to all of you for all the extra work that we did. I know that wasn't a good experience. We overnighted the correct information in an apology letter, so I hope that you guys all received that. The purpose of today's session really is to review this plan, that you have an option to enroll in. So, you'll all be able to look at this plan and evaluate what the benefits and features are, and compare it to what you have right now. Again, how Amy has sent out what everything is for the new year. So again, I just really wanted to do that. My thanks to Amy again for fielding those calls. She, you can tell she cares really deeply for you, because we're like, can we help you? Can we help you? And she's like, no, I want to talk to my retirees. So I do think that's admirable. So with this is Tracy Yaman on my team. I always say Yaman.
Okay.
And she's gonna start off the presentation, and I just, feel free to write down your questions, and we'll be sure that we get you what you need. Okay, thanks.
Thank you, Ms. Liz. So before I get started, because this is the most important, is we have Blue Cross swag for you guys in the back. So there's a bag, a little fidget cube and some pens and sanitizing pens. So make sure you do stop by to grab some of that on your way out. And then again, make sure we have Michelle from Pharmacies here, and then Silver Sneakers. So Stephanie, she's so excited. She's a fitness instructor too back there. She's got her hands going already. So anyways, but Stephanie will, I'm actually gonna bring her up shortly when we get to the Silver Sneaker section. So you'll get a break from my voice and from Liz's voice for a few, and then Stephanie can share some Silver Sneakers information with you. So, but what we can do is we can go ahead and get started.
Drive the slides. Want me to do the slides then? Okay.
All right, so what we have obviously on the first page, it just says Marion County, Medicare Advantage prescription drug plan. So we can go ahead and flip that slide. And today's agenda, we're just going to kind of talk about Medicare Basics. We'll talk about getting started with the plan. We'll just briefly touch on some of the benefits, prescription drugs, and then we'll talk about some of our health and well-being plans, programs for you guys as well. So for our Medicare Basics, a lot of especially today, right now, every time I turn on the TV, there's a Medicare Advantage sales pitch commercial. So I actually recorded one for Amy, but I didn't give it to her yet. But so it's very confusing, with Medicare Advantage, because they're talking about their annual enrollment periods where you can make changes. So again, what we're offering is Medicare Advantage is a plan. And what our plan includes, it includes your Part A. And you can see there's hospital care in the Part A, the skilled nursing. Part B has got your provider care, your visits, your mental health care. And then Part Z is your prescription drugs. I call this the ABCs because you've got A, B, D, but we call it the C. It's where your Medicare Advantage plan comes in.
If you took your mask off, maybe we could hear you.
I don't want to, well, I would love to take my mask off, but I'm afraid if I cough, I don't want to cough and make anybody uncomfortable, so.
Will it make you uncomfortable if she coughs?
No.
Are you sure?
Yeah.
She has sinus throat.
Yeah, you might have to write that down. Okay, so if I cough, then I will, have Liz take over for a second. So anyways, the ABCs, which is Medicare Advantage. You know, you have your Part A, your Part B, which will continue to still pay your Part B premium, and then your Part B is your prescription drugs. Cool. So getting started with your PPO plan. As you can see, this beautiful red, white, and blue card here, that's your Medicare card. And this is what your Blue Cross Blue Shield of Michigan Medicare Advantage card will look like. Okay, so one good thing about this is 99.9% of all your services, you're only going to need to bring your Medicare Advantage card from Blue Cross Blue Shield of Michigan. That means you can put your Medicare card in a safe place unless there is a reason that you might need to bring it based on something that CMS or the government might have asked you to do.
Oh, there you go. Thank
And
you.
then the next slide, it's going to show you what the back of your card is going to look like. So this would be your front of your card, and then this would be the back of your ID card. So you will receive a new ID card. You will receive a new Blue Cross Blue Shield number when you do enroll into the Medicare Advantage plan, okay? So the current Blue Cross ID that you have will no longer be used as of 1/1/2022 if you do decide to enroll in the Medicare Advantage plan.
Next.
Yeah, we can go to the next slide.
Okay.
So what you can expect if you do decide to enroll is when we will contact you. You'll receive a welcome call from one of our fabulous customer service associates. You will also receive a new ID card. You will also receive in the mail a health assessment form that you can bring with you to your annual physical and have your doctor fill that out. If you choose, it is optional. One of the benefits of this is this will give our team at Blue Cross a little bit of insight as to maybe you might qualify for one of our programs that could benefit you. Also, in the right before we go live, 1/1/2022, there's going to be a few days lag time, and I mean, so you're going to enroll in Medicare Advantage. So, January 1st, you're going to go into this wonderful new plan, but there's going to be a few days in December where CMS Medicare is going to say, you know what, they might have two coverages, which is true, you might, because they might not see an end date in one system yet. So you might receive this coordination of benefits survey that says you might have an extra plan of Medicare Part D. And really, you can just disregard that letter if you do receive it. This is something that is required by CMS that we do follow. So unfortunately, you would have to get this in the mail if there's a timing situation from when the enrollments are processed. So I do apologize if that will confuse you. You probably will not remember that from today out, but again, so you would not have to worry about anything, because if you have one coverage, you have one coverage. I think we can go ahead and switch this. So understanding your Medicare Advantage materials. So before enrollment, pre-enrollment documents, you should have received the opt-in form and the opt-in enrollment kit. Okay, so we already cleared that part up. But what you can expect to receive is your post-enrollment documents, which would be your welcome letter. And I think a couple members have asked me about this, that I was actually helping Amy field some calls and answer some additional questions, is you're going to receive an evidence of coverage document. It's a very large document which explains the Medicare Advantage plan in detail. So it's going to kind of give you an idea of how your plan works in very good detail. It's called an evidence of coverage chart. And it could be about 98 pages long.
It's larger than that.
Oh, it's larger than that.
It's about 300, because with the Medicare Advantage plan, like Tracy was saying earlier, it's a Part C, so it's going to combine your current Part A, your current Part B. It's going to bring them all together into a single plan. And you will have all of the same rights you do as an original Medicare, with all of the protections and all of that information. If Medicare adds a benefit, your Medicare Advantage plan would also have that benefit added. For instance, a couple years back, they had lung cancer screening, and that was added as a preventive service to all Medicare beneficiaries, so we'll pick up those plans that benefit entire plans. So this is just a different approach to administering your Medicare Advantage, your Medicare benefits with your employer group. We're also able to do, like Tracy was saying earlier, and we'll get into that in a little bit after we run through the benefit slides, we'll be able to show you some of the additional programs that are available, our Silver Sneakers, which is an additional program. We have lots of wellness and care management programs we're gonna get into in a little bit. And we'll go through all of those and explain that, because those are all additional value and benefits that are brought to you through Medicare Advantage. So, Tracy, do you want to keep going, or you need a little break?
I'll take a little break just because.
Yeah.
And then I can drive
You
for a
can do the
bit.
slides? Okay.
I mean, believe it or not, I'm a fitness instructor, but it's just.
So, like we said, the most important thing is going to be your opt-out form. You did opt-in form, excuse me, opt-in form, and you're going to complete that, and then you're gonna return that to the County of Berrien. We also included the address in the apology letter that we sent to, so please make sure that you send that. I think Tracy talked a little bit about coordination of benefits, and when you're filling out that form, if you have other coverage, you indicate that on there, and if you don't, you can leave it blank and you will not get that letter. Yes, we have a question in the back.
I never received that packet.
Okay, her question or statement was, I never received that packet, so what we can do is we'll take a look at your name and your information after the meeting. We've got our mail files, so we can check and see if we sent it to the right address, and we can track it down for you, so.
Do you know who that was?
Well, we can get that after the meeting, yeah.
We can.
Yeah, so anybody that didn't receive a packet, stay for a minute, we'll collect your names, and when we get back into the office tomorrow, we'll look and see where that is, and then we'll make sure that you get the information that you need. Do you wanna go to the next slide?
Yep.
I have a quick question. Where did they mail the opt-in, where do we mail the opt-in form to?
The opt-in form, yeah.
You can either leave it today, if you want to leave it today, or
Okay.
you're gonna mail it back to me.
Okay,
It goes back to the 701 Main Street in St. Joe.
thank you.
Good question. Did everyone hear that? It's a 701 North Main
No,
Street.
just Main Street.
Oh, just Main
Yeah.
Street, Main Street in St. Joe.
The form that you should have received in your packet does have that address on it, like I think it's like page 4. But, you know, we can definitely be proactive and make sure that we touch on that address a few times if needed.
Okay, so when you are in the Medicare Advantage plan, I think some of you may have been used to receiving a summary of benefits if you have a claim, and it has to come from Medicare. And then you get your explanation of benefits from Blue Cross, and so you got this one, summary of benefits sitting here from Medicare. You want to match it with Blue Cross because you want to make sure you're paying, you know, what you need to pay your doctor and not overpaying. Well, with us in the Medicare Advantage plan, we're gonna give you a single explanation of benefits, so we're gonna make it a little bit easier on you. So you use that original ID card, like Tracy was saying, for most services. The reason why she said most services is because you may need to bring your red, white, and blue card, shall you be getting any booster shots for the COVID vaccine. You know, that legislation and the rules changed quite quickly. So we do see something in the 22 Medicare and U card that handbook that says to bring both your red, white, and blue card and your Medicare Advantage card if you're gonna be getting the booster, if you haven't had your shots yet. So other than that, you're really gonna use just your Medicare Advantage card. You'll get a summary of your benefits. It's gonna track your deductibles. You don't have to match it up with anything. You,
Yeah, one EOB. I'm sorry, I
there'll be
coughed.
just a single
Yep.
explanation of benefits.
Mhm.
So when you have a claim and your provider bills us, if you went in January, the provider didn't bill us until February, in March, you would get an explanation of benefits, because we're gonna give you that explanation of benefits once we receive that claim from your provider. So that's a little bit nicer than having to worry about all the different matchups. Next slide. Okay, on your prescription drugs, you will have an explanation of benefits for your prescription drug. That will come again when your prescriptions are filled and when that claim has been sent in to us. It's gonna tell you where it is. Now, please, Because we are a Medicare Part C plan, and the group plans are modeled after the, original Medicare Part D benefit. So you hear things about donut holes and catastrophic and all of this stuff. You guys can really say, that doesn't apply to me, because it doesn't. It may show up on this statement because, of course, there's language in there that the government, because it is a Medicare plan, puts in there. But you have whatever co-pays that we're gonna go through are going to be your co-pays for your prescription drugs. You do not need to worry about a donut hole. You do not need to worry about catastrophic phases. You do not need to worry about anything changing. It's going to work exactly how it works right now. Where if you have a copay for a generic drug on January 1, it's going to be that same copay if you get that prescription filled on December 31.
Unless you go to a preferred pharmacy, it'll be a little cheaper. We'll get into that in a few minutes. Yeah, few minutes. Here we go. So here.
So, are you guys familiar with some of these? Now we'll go through a little bit of a reminder. So most plans are designed with a deductible, and that's the amount that you would pay. It works similar to like an auto deductible, right? We get in a car accident, they're gonna say you have to give me a certain amount that you selected ahead of time. Once you fulfill that, then we begin to pay. So, plans have deductibles. They also have co-insurance. And co-insurance is the percentage that you and the plan would pay. So on items in your summary of benefits that you have, and it says co-insurance, that the part that is represented on that document is the part that you pay. Co-payment is a fixed dollar amount that you pay to your healthcare providers each time you use their services. Things that have fixed co-pays are like office visits, emergency rooms, so you know exactly what you're gonna pay for more of those routine services. And then in a Medicare Advantage plan, you're gonna have the out-of-pocket maximum. So we're gonna collect those co-pays that you paid for your medical services. And you will have an amount that once your co-pays meet that amount, the plan will pay out 100% for the rest of the year. Next slide. Okay, so the plan that was designed for you, you're gonna notice there's two columns here, in network and out of network. So Berrien County was able to select from a plan that said, can I design it where my members pay a different amount, a lower amount in network and a higher amount out of network? They were given that choice, they said no. As long as they see a Medicare participating provider that accepts the Blue Cross card, your copay will be the same. So, so where you see not applicable, that just means follow the copays, and that is what your cost share would be. So your plan would have an annual deductible per member per year of $250. Once, and that's not on all services. Remember on the last slide where I said there's copays? So, if it says subject to deductible and co-insurance, such as outpatient surgery, then that would be subject to the deductible and copay. So the co-insurance is gonna be 10%, and then your out-of-pocket maximum, where we're gonna collect everything that you pay, is gonna end when you paid $1,250 for your medical services.
And that includes your $250 deductible. So it's just like it is now, they just word it a little bit different. So I'll always tell you, you have your $250, plan pays 90%, you pay 10%, up to an additional $1,000. Okay, so that part didn't change.
I'm gonna take off my
It's
warm sweater.
It's
It
warm
is a
in
little warm. But that's good, because it was really cold this morning when I got up, so I will take the last day of warmth anytime I can. Okay, so we'll go on to any questions on that?
March.
Yes.
At this time, I also paid the $250 deductible to Blue Cross, but then there's also a deductible for Medicare. We still have that.
Okay, so her question was, at this time I paid my Blue Cross deductible for this year 21, and then I also have a deductible before you go see the physician.
No, it's a Medicare deductible.
The Medicare deductible.
And you pay it, every year you have to meet it in addition to the $250.
When you go see your doctor for your doctor office visits, correct?
For anything, really.
Yeah. So this deductible applies to
hospital, physician, outpatient, all of those services. So you only have one deductible. So if you're paying 2 deductibles now, you only have to pay the one, okay?
That's
Makes
what I was
sense?
thinking, that since we won't have original Medicare, we would not have that Medicare deductible.
You're correct.
Right, the Medicare deductible.
Mhm.
Okay, but please don't get that confused with the amount that they take out of your social security check for Part B, because that always, always, always will be there, no matter if you're in a Medicare Advantage plan, a Medicare supplement plan, offered by your employer group or an individual, that'll always be there.
Sure, I understand that.
Okay,
But
good.
you're not gonna have to pay additional for Part D.
No,
That's gonna be included.
Mm-hmm.
correct, correct.
Mhm.
So her question was, her statement was, I'm not gonna pay additional for Part B or D, and that is correct. She does not have to pay the additional amount that she's
For D.
paying.
Mhm.
Yes,
For instance, if you go out of the network with, like, take a Cleveland Clinic or something like that, that would be out of the network, right?
if they, so her question is, what if I wanna have services at Cleveland Clinic and they're not in your network, what happens then? Most providers, well, if they accept Medicare, they will accept your Blue Cross card, so that's something that as you're planning for your surgery and your services, you'll let them know that you have this Medicare Advantage plan. If you accept Medicare, you'll give them your Medicare Advantage information, and then they would bill us, and we would pay as if that provider was in our network, okay? And we have a slide that speaks to that in a little bit to tell you what to do.
So you would pay as though they would be in the plan, in the regular plan.
Correct, correct.
It's like, it's a passive network, which means if anywhere in and out of network, as long as your provider accepts original Medicare, they will accept our Blue Cross card.
We
So
kept it just like it is
Mhm.
now. Okay, so that piece didn't change.
Yeah, they're gonna treat it like it's in network. Okay?
Oh, yeah, do you want to explain the copay?
Oh, this is like a little bit of enhancement,
So-
right?
So the two changes that we made
Yeah.
were on copays at two different places. So the first is the emergency room. I didn't want anybody to not seek treatment if they're having chest pain because they're worried about it going to their deductible and they're out of pocket. I want you to be able to go to the emergency room. So it was a $50 flat copay to go to the ER. I'm gonna tell you that it's $1,000 just to walk in the door, roughly, about. So no matter what services you had done in the ER, it's a flat $50 copay. If you were admitted from the emergency room to the hospital and you stayed, you would not pay the $50. It would then go towards your deductible and you're out of pocket. Does that make sense? The next piece is a $25 urgent care copay that we haven't had before. And this I thought would be a benefit if you were sick. And again, you didn't think, some people, money's tight. And if you needed to go to an urgent care because you were ill and to see a doctor, so this would be urgent care and walk-in clinics only. You would have a $25 copay. But for that $25, again, you could have any of the services that you needed at that walk-in, and that's all that you would pay is the $25, okay? So those changes that were made, I thought would help you, and that was the reason that I made the changes that I made. Okay, yes,
So what is it now?
now it goes towards deductible and pays at 90%. So you'd have to hit that 250 if you hadn't, already. I had another hand, yes.
Yeah, so I understand correctly, then if you go to the ER or go to urgent care, you have to have that amount of money on you to go to pay them right then? The 50 or the 25?
No.
Typically, no.
No.
They usually send you a bill.
Yeah, they should bill you just like they would, a lot of times, even with our active employees, and Diane can contest, I tell them, don't ever pay them up front, because getting the money back is never easy. So it's easy, they ask, do you have a copay? No. I don't have a copay. So even though we say we're gonna, the county right now is paying 90% and you pay the 10%, you don't have a flat copay when you go to the doctor. So I always tell them not to pay,
because getting them to pay you back will take forever and a day. So it's just easier for them to send you a bill and then you can pay them from there, okay? I wanted to explain that because that was a change that we made, but I made it consciously and went back and forth both ways and thought that this could benefit you, and they know, because I went way back and forth for a long time, that it could benefit you in the long run, okay? That's all.
Oh, thank you for pointing that out, yes, she worked very, very hard on this plan. Okay, so here, this slide really is just an overview of the most common services. So if we look at your office visit, that would be subject to deductible and co-insurance, specialist visits. So if you're going to see maybe a doctor for rheumatology, a specialist, or a heart specialist, deductible, co-insurance. Chiropractic manipulations, that continues to be a benefit that would be subject to deductible and co-insurance and ambulance service. So that really is a nice feature to be able to have comfort, like Amy was saying, if I have an emergency, not to have to worry about, oh gosh, I'm gonna have a deductible if I go there, and really put off making that decision, as well as urgent care facilities. So, next slide. Okay, as you go through your benefit summary, you may see something with a little star on it and says prior authorization is required. That's really nothing new. This slide really is here to point out that it's something that your physician does. So if your physician tells you you have to get prior authorization, it's up to them to get prior authorization. And what that means is the physician would just contact the plan to let them know that you're having a surgery. We want to make sure that, they've done all the appropriate, blood work, that type of stuff, that they have everything. It's like a protection for you, and for the physician to make sure we're not missing any steps for you. But that is the physician's responsibility. You probably have services right now that you've been enjoying under your current plan that you don't know that's happening. But just in case. Next slide.
Can I ask a question?
Yes.
Does that prior authorization apply to say you have a prescription at the pharmacy?
Yes, we'll get
Now, how
into,
is that supposed to work? Because I've had a situation, not with my insurance, but someone told me it was. Part B, I was with Part B. And so who's gonna cover?
that's a good question. So her question is, can we talk about prior authorizations in regard to prescription drugs? Because there are some services that are covered under Medicare Part B, as in boy, particularly when we get to vaccinations. We do have a slide later in the presentation that speaks to that. So thank you, because that is something very important to know. And then we also will go over what prior authorization means for you in regards to Medicare Advantage, in regards to the prescription drug part of your plan. So next slide, please. Is there wait, I thought I saw another hand. No? Okay. Okay, so we talked a little bit about PPO. PPO means Preferred Provider Organization. And what that means is that those doctors have signed a contract with Blue Cross and Blue Shield to accept our plan, to accept our fee schedule, to accept our members. They go through a credentialing process. So you know that you're getting a good quality doctor when you choose a doctor who accepts PPO and is in our network. So that's one advantage. You can choose any provider though under this plan that participates with Medicare and agrees to accept and bill our plan. So that's what passive PPO means. Your out-of-pockets are less when your care is provided by an in-network PPO, that's true. If we did not design it with the Thalia variant to make it passive, so it works for any Medicare provider. Referrals aren't required, it's not an HMO, it doesn't require referrals to specialists. And your in-network and out-of-network, like we say, are the same with the passive plan. So that's what you have, a passive PPO.
I've had a lot of questions regarding the traditional versus the PPO. The traditional plan is how I've explained it, is pretty much a dinosaur. So probably 15 years ago, traditional plans went by the wayside. So you really bid in a PPO network per se. Sometimes you may call the Blues and they'll say, oh, your PPO provider or this PPO. They don't look to see the TRAD, the little TRAD that's on your card. The traditional, you've pretty much been under a PPO plan and you really don't know it. So, we had a few extra perks, if you will. You didn't have to get a referral for an MRI or a CT scan. That will be required, under Medicare Advantage. But that's how almost all plans are, so.
Yeah, and you'll see that prior authorization is kind of like a quality of care initiative. A lot of providers want to make sure that you're protected and they're protected. Before we enter in such a significant thing such as the surgical intervention. So I need my Tracy back. I'm gonna grab a little bit.
I was looking for your water, I couldn't find it.
Yeah, no, it's right here, I found it.
Okay.
Need a little sip.
I know, and I keep coughing over here.
So how do you find a participating provider? And this slide right here, one of the important things that we will do is once you submit your application form and you enroll in the plan, in about January, could start maybe the end of the year, it depends on when your actual enrollment is processed, you will get a call from us. And it will be our member servicing representatives. They are an excellent team to work with. And they will ask you, number one, do you welcome to the plan. And then they will ask you, do you have questions? What do you need to know? What have you been thinking about that as you've been in the plan or as you've reviewed materials that you maybe want to go over one more time with us? We want to make sure you are totally comfortable, all your questions are answered, and that you have someone there that you can depend on to help you navigate this healthcare world. So they're gonna call and check to see if you want them to go through your list of doctors and see if they're in the network. Because if it's in the network, then right away everything's okay. So they'll go through that. You can call customer service. You can call them right now. We did do a field alert to say, we're excited, the County of Berrien members are coming in, and so they'll have your information. You could call them and they can help you look out providers. We do have some information of customer service in your letters. You can you can visit, if you like to go on the web, www.bcbsm.medicare, find the doctor. So you can go in there and look them up on your own. Other things you can do, ask the billing department of your provider's office if they participate. Tracy, they didn't fix our typo. If they participate with the Medicare Advantage PPO plan by Blue Cross, okay? So in other words, if they accept Medicare, will they bill your Blue Cross card? So you just wanna make sure that you do that. And then you download our Blue Cross mobile app if you haven't already in your current retiree plan. It's available in the App Store, iPhones and Google Play for any of those devices that are listed up here on the slide. Okay? We have a question.
So there's no cost difference as far as if your doctor is in the network or out of the network? No cost is the same?
Yeah, so her question is, there's no cost difference whether my doctor is in your PPO network or not, and that is correct. So if you see a Medicare provider for an office visit, and it was subject, let's take, everything's subject to deductible and copay, and co-insurance. I like to do just a copay as an example, it's easier, but if you see a doctor that's in our PPO network and you have to pay your deductible, and you see a doctor that accepts Medicare, but he hasn't signed a formal contract with us, but he's willing to bill our plan, then again, you would pay, that money would be the deductible. And it will all count towards your out-of-pocket maximum. Yes, we have another question.
Yeah, I spent quite a bit of time out of state, and actually in 4 different states. And when I've been in the doctor's office, I see a long list of Medicare programs that are not accepted. So that's my concern. What would happen to me if I were in one of these 4 states and had to see all this massive list with Blue Cross and Shield Advantage on there?
Okay, so her statement first is I go to 4 states quite frequently, and my statement is I'm really jealous. I wish I could do the same. But her concern is that she may see on certain providers that they don't accept Medicare Advantage, or they don't accept a Blue Cross plan. We can't force a provider to bill our plan if they haven't signed that formal contract. So, again, if you're going to see a doctor and you're going to, consider surgery or have services, you have to have that conversation up front to let them know what plan that you have. If you're going there for emergency or urgent services, then yes, you are covered anywhere throughout the United States.
And if there's.
That is a Medicare rule. So whether they participate or not, whether they have that sign or not. Medical emergency. Right. Yes.
Just to sort of expand on that, say I moved to Florida, I permanently moved there. Does this plan, is that in that service area or not?
Yes, yes. So her question is, she's thinking of moving to Florida. I think maybe we all are right now, as it's starting to get up. Although I tell you what, those colors were amazing on 94. I had pockets there, and I was like, this is the wall I've been waiting for. But, yes, we do. And actually, what we do is, because Blue Cross and Blue Shield is throughout the United States, and we use our association plans, what would happen is, you'd probably find a Florida participating PPO provider in that Blue Cross plan, and they'd be, oh yeah, this is Blue Cross, so they would know how to bill us. So it really is good to look at the Blue Cross providers throughout the United States, and to do that information ahead of time if you're traveling. It's always good because, if something happens, we're all in the thick of it, right? And we are like, oh, what do we do now? Who do we call? So it does behoove us to take a little time to do that research if we're traveling ahead of time, because you're just prepared, and you never know. And when something terrible happens, it's a difficult time to be scrambling. So that's just something I know from working with my mom and dad that I like to pass along. Yes.
I checked and my doctor is in your plan, so I'm thrilled to death about that. But the thing is, I don't see my doctor. I mean, I may wave to him in the hallway, but I see his nurse practitioner all the time. And every year for my wellness check, and everything. And of course, the doctor office submits it. And under the plan we have right now, they do pay for it, of course, minus my deductible, if I've met my $250 deductible. Will that be the same with this program? If the nurse practitioner does it instead of the actual doctor?
Yeah, and if everybody heard that kind of scenario, she was saying that she has a physician. A lot of times when she gets in for her appointment, it's the nurse practitioner that sees her. And under the current process, because the provider is participating and the people that are seeing her are under that provider, it's going to the plan, it's being paid, and she's just responsible for her deductible and co-insurance. Did I say that right? Okay, and the answer is that would still be the same under the Medicare Advantage PPO. Okay? Anything else?
Good.
Okay. I like these questions. Okay, so online visits. Has anybody used online visits at all in this room? Yeah, oh, a few doctors. Good. So you will continue to have online visits through Blue Cross and Blue Shield. It'll be available through your current Blue Cross Blue Shield online visit site that you currently have, so you don't need to do anything new there. And the advantage to that is when your primary care provider is not available, you can want to have a quick visit with a physician to kind of talk about what's going on. One example that I like to give is sometimes, when winter comes and it's snowing, and I don't know if you may be a little nervous about getting out in that snow, and you have a cold, you think it's turning into a sinus infection, and you want to see a doctor, but I don't want to break my ankle on the way out, but you know you need something. This is a good avenue to kind of go to, is to use our online services to have a physician see you and be able to walk you through the symptoms, perhaps issue a prescription if that's required, depending on what your symptoms are. So you will continue to have that. All of our doctors are telehealth experts. They're US board certified, licensed and credentialed. Remember, it's for non-emergency. And it's for those medical visits on demand. Now, all of those that use that, do I have the same hands coming up that you liked it? It was easy? Was it hard? Easy?
It worked.
It worked? It worked, okay. So we have a couple of testimonials. Look at those that raised their hand if you have more questions about it, because it's always good to hear what other people's experience is if you're a little cautious about things. Okay, and then here's the mobile app. If you have the mobile app right now, it'll be the same mobile app. The information will be updated to your Medicare Advantage information once your enrollment is processed into our plan. You can use it to find primary care physicians, look up doctors, track your costs, check your claims, view your plan coverages, get your ID card. I just went through all of my annual end of the year physicals, and I went with my phone and just presented the ID card. It was really, really easy, because what I do is I pass them out to my husbands and my sons, and I forget to keep one for myself. So I was like, good, I got my phone. So those will be pushed to your phones too. Here, mail is running a little delayed. So if you do not receive that ID card, our best intent is to get it to you. We have all of our systems where we're prepped and ready to get you that ID card. We try and get it at least 10 days prior to your effective date, but with mailing and everything that's going on right now, in case it doesn't come, you can use it on your phone through the mobile app.
Your question? Yeah.
Yes.
Can we download that app now?
Yeah, everybody could now. If you wanted to take a minute, we can all go to the app store and download. But it's pretty easy, and I think you like it. You can even do it right now for the current plan that you're in. Is that right?
Yep.
Yeah.
I would
Okay.
yeah.
Okay. So we'll go to the next slide. Okay. So we touched on this a couple of times, a little bit already through some of the questions. We have, as you retired and you worked very hard to travel, and you're gonna go visit your friends, your family, see places that you've been planning. So what's very important is there could be an emergency or an urgent situation that pops up, and you are covered with Blue Cross and Blue Shield for emergency and urgent care worldwide, and then you are covered throughout the United States. So the card is recognized. It's also, some of us here in this room may be fortunate enough to have dual residences, or maybe you, in the winter, you go and stay with your family who live in a warmer part of the country. And what's nice is that you can use those providers who are in that Blue Cross plan, or the Medicare providers that's going to travel with you. So it's an excellent feature, so you don't have to worry about providers not taking your card while you travel.
Cool.
Okay, this question, this right here, so durable medical equipment. Your durable medical equipment, which are things such as the canes, the walkers, the wheelchairs, those kinds of things that you may need to assist you in performing duties. Those are available through our preferred durable medical equipment provider. That's Northwood Network. That is our preferred provider. We do have additional lists of participating in-network DME providers as well, and more information on that is found in our materials online and that you'll be receiving. So that's where your provider would typically write a prescription for durable medical equipment. Easiest way to get it filled is through Northwood, because they are a preferred provider. But of course, if you want to use another in-network provider, you can. Diabetes monitoring supplies, insulin pumps, blood glucose monitors, test strips, and lancets. Those are provided through J&B Medical Supply. So I don't know if you guys are already familiar with that. Again, that's our preferred provider as well, but we do have other providers out there. You can go, you can even have those questions with our customer service reps, let them know who you're using right now, and they'll check it for you and let you know. Okay.
So they currently get them through Express Scripts, you'll be able to do that.
Yes. Oh, the question here was, I get some of my diabetic supplies through Express Scripts. Will I be able to do that through them still? And the answer is yes. Express Scripts is our provider as well.
With Medicare Advantage, because.
With Medicare Advantage, yes.
Oh, yeah.
Excuse me,
Yes,
I have some experience with J&B supply.
you do?
Yeah.
Okay.
And it's not through my insurance, but it's through my mother's insurance. And the problem that I've been dealing with them is she was released from a nursing home. And she had to have all this equipment and all of this stuff set up prior to discharge. For some apparent reason, they didn't get it scripted. So she has a visiting physician that comes to the home who wrote the prescription. This has been going on about 6 weeks. So prescription was wrote and didn't have the diagnosis codes or something on it. So they sent it back in, actually they faxed it back in. So when they faxed it in, because I don't know if they have an email. Sometimes when you fax documents, because it was faxed through Staples or someplace, they cut off part of the date. So they still refuse to accept the prescription. So to me, dealing with them and you're having these kind of problems, I just don't know what to do. Because if it's gonna, and then they kind of get me kind of hurt because I'm dealing with that and another situation. And if we're gonna have to have a situation where I'm gonna have to send it in, I always thought that they deal directly through the doctors. But they've been calling me constantly, saying, we'll get this. So this thing has been going on for about 6 weeks. So I just don't know how that is set up, if ours is gonna be set up any way, if the doctor's gonna be.
Is she with the Medicare Advantage plan today? Is it with Blue Cross?
No, it's just do something.
No problem.
But J&B is a supply.
Okay.
So they must be pretty big.
What we would recommend, under our plan is, our customer service is phenomenal. They will call on your behalf. They will call you, like, if someone came to me and said, hey, I need some help, I'd actually have my customer service team call you. So our customer service would actually help you with that situation and try to get it resolved for you without trying to go back and forth for as long as you've done it. That should not have happened.
Okay, because it's hard to get in touch with them. My experience, you send messages to the portal, it takes 6 or 7 days for them to respond. So that, to me, is a red flag.
And it's not a Blue Cross Medicare.
That's not
Right,
right.
it's not,
That's
right.
how they treat
Yeah.
all insurance?
No.
I can't speak to how they treat other insurances, but what I can also let you know is that our member servicing team, it services not only the members, but the providers. Why is that important and what does that mean to you? That means that your provider isn't directed to call into another area and go over the story again. That means that member service representative can actually call that provider themselves and work out that claim on your behalf. That is a huge, huge advantage in Medicare Advantage. Some of these other carriers that she has given an example of will do that. They'll be like, you call that or have the doctor call here and you're the member and all of that. We take that in and we're able to route and work with your providers, work with your members. Tracy's nodding her head here because, she was kind of amazed that we had a customer service unit that was set up to service not only your providers, but to service you as well.
They're very good.
We currently have Blue Cross and Blue Shield. This is also Blue Cross and Blue Shield. Completely different companies, completely different customer service people, even though they're both Blue Cross and Blue Shield.
So her question is this a different company? This is Blue Cross and Blue Shield. This is the Medicare Advantage Senior Health Services Division within Blue Cross and Blue Shield. Okay, the current plan that you're in is administered in our active group market. So just think of it as two different products. One's an ILB and the other's an ILC. Yeah.
Thank you.
It would be a different customer service, yes. That's why I said you're gonna get a different ID number.
It's a different customer service number, yes. Yes, totally different team. Mm-hmm. They actually specialize in, and I think we have this slide right here. Oh, good, it's right up here. They are designated to Medicare Advantage. They do over 150 hours of training. We also have them go into training to make sure that they understand how to treat people with empathy and respect, just to remind you of that. We're very, very proud of the training modules that we offer to our customer service representatives to help them help you. Because I'll give this example every time. When I am sick, I am not the most pleasant person to deal with, and I don't know if you're like that, but I definitely am. And so if I didn't do my homework ahead of time, and all of a sudden I'm sick, and you start talking to me in this healthcare language and acronyms that I don't know, I am frustrated all out, and that isn't plain. And so those customer service reps go through that training to understand that. So it's kind of like a partnership. Let's try and understand a little bit what we can do to help prepare, because we know we're going to be not in a good mood, not feeling well, facing some things that aren't nice to deal with. But then our reps are also respectful of that as well, and they will take, just as we are committed to taking this meeting, making sure that we answer every question you have, to make sure that you are okay before they hang up with you. Okay? Next slide. Yes.
Are these reps based in the United States, or are you gonna have a language issue?
Oh, that's a question. Are these reps based in the United States? Yes, they are. Yes, they are. They work in downtown Detroit. I think we also have a couple during open enrollment season. We may have some offices that we also open up in Grand Rapids, but it's all within Michigan. Whether they have an accent or not,
They're what we call
France,
local.
I don't know.
They're what I call local, because I'm from 3 hours away, so.
Yeah,
They are.
they're all from here, yeah. Okay. Prescription drugs, so we're good with everything up to there. So prescription drugs. So when we talk about our prescription drug program, I think most of you will, if you've had healthcare coverage for a while now, you've kind of seen how the industry used to have just one copay, it covered everything. Then we made brand and generics, and we make copays for that. This slide just simply is to introduce to you that your drug plan will have the tiers of drugs. Those tiers and those copays will be called, for tier 1 will be preferred generic drugs, tier 2 will be generics, tier 3 will be preferred brand name drugs, and tier 4 will be non-preferred drugs, and tier 5 is specialty drugs. Again, I think we touched on this earlier, but I always like to reiterate it. Your plan does not have a coverage gap. So, you do have a Part D plan, but it does not have a coverage gap. It does not have catastrophic. It doesn't have the catastrophic where your costs, when we get to catastrophic, when you get to catastrophic, you may see a slight reduction in your generic drug copays, because we do track that behind the scenes. It's information that, being government contracted with CMS, that we do. We do look at prescription drug costs. So if you were to reach in copays over, I think it's $75.50 this year, or in 22, then you could see if your prescription drug, it could drop to like $8.95.
It's like, if you did 983 or 3, it's like,
Yeah. But I think
The
your
new
copays
law
are
is
better
coming out.
than that, so we're gonna get to that in a minute. So here we go. Now in the tiered preferred generic drugs, so I think it's like $9.85, so they might say 15 cents. But you have a very good plan. So this plan, I thought we had to change the order of this, because I wanted to introduce that under the plan, we're gonna have preferred pharmacies. And at preferred pharmacies, you're gonna have a lower cost share. And the next slide will actually show you what those preferred pharmacies are. And then you're gonna have standard pharmacies. So that's gonna be all pharmacies that didn't contract with us preferred, meaning that they're gonna accept a lower copay when you go and receive your prescription drugs. So when we look at those tiers again.
You wanna talk, go back to that one?
Oh, okay, yeah, so we'll go through the pharmacy network first, yeah, good idea.
Okay.
There we go. So when we go through it, 62,000 pharmacies nationwide, 23,000, so more than half of them are preferred. When we talk about the preferred chain, they're gonna be your chain pharmacies, your Costco, your Kroger's, your Myers, your Rite Aid, Sam Clubs, Walgreens, and Walmart. So those, if you go there, you're gonna have a lower cost share. If you still wanna go to CVS, you'll be able to get your drug coverage, you may pay a little higher cost share. Our mail order, when we have mail order home delivery, you can use Express Scripts, which is preferred, the P, and then you have Alliance RX Walgreens, which would be standard for home delivery. So now, understand the plan has a pharmacy network, and depending on the location of your choice, it's your choice, who you're happy with, who you want to go with to get your prescription drugs. If that pharmacy is preferred, you'll get a lower copay for generic drugs in tier 1 and tier 2, it's going to be $10. Tier 3, it'll be $25, and 4 will be $25, and specialty drugs, $25. Okay?
Like today, I believe you're used to paying these co-pays where my hand is. So, and this is a standard, so if you did go to like a standard pharmacy, you would continue to pay those co-pays, but if you went to a preferred pharmacy, you get a $5 break.
And she didn't call.
I didn't call. Because
That's because you did go to the pharmacy.
if I keep my mouth shut for a few, it does help.
Yeah, we have a question, I think, okay, quick question here. On the paperwork that we received on page 10, it says that tier 5 specialty tier is not offered.
For mail order.
Not for mail order.
Oh, for me.
For
Yeah.
mail order, for mail order.
And you do know with the mail order that I believe it stayed the same. You pay for 1 month
Mm-hmm.
and you get 2 months for free.
Yep, no, that's right.
to your door. So you don't have to go anywhere.
It's correct, 32 to 90 day supply. It's your preferred or standard copay.
See, I think there's a third column, but we have a little bit of the video going here that's, you can't
Yep.
see it, but that says 32 to 90 day. So if you use preferred, which was on the previous slide, then it's a $10, and it was Walgreens, right? I'm not
Yeah,
saying
Walgreens,
yeah.
Costco.
Okay, yeah, and then $15 for the standard, for the 90.
And Express
32
Scripts
to
will send it
90.
right to you.
Express Scripts is preferred, yep. Just like you're used to today. Yep.
What is a specialty drug?
So her question is, what is a specialty drug? So that's on tier 5. And the specialty drugs may be things that need special handling, special refrigeration, those kind of things. So you really wouldn't want to get into a 90-day supply of that. It could be something that you need to go at regular intervals, which may be less than 90 days to make sure that you're getting your liver enzymes tested, that type of thing. So we don't want to stack you up with 90 days. If there needs to be a change in prescription for that, or if it needs special handling and refrigeration methods to keep it working with the efficacy that it needs. Good question.
I like to say it's like a chronic illness. So and it's good that you don't know what that is because that means you don't fall into that category. So.
Yeah, you have a question back here?
I take a very expensive drug that I get through our county insurance, 90 days I get for $30. If I had to pay for that, it would be like $1,300. Is this going to cover that same prescription?
Okay, so
Michelle?
this woman has a question, giving a very specific example. And I am happy to say that I can't answer that openly here, but what we do have is we have Michelle in the back of the room, our pharmacy partner, and she can actually look up the name of the drug, very versed on a lot of the different things that go on out there, so she'll get you the right answer. But that's a good question. And anybody else who has concerns with something that you're on after the meeting, Michelle will be back there and we'll be able to help you with questions on looking up where your prescription drugs are on the formulary and any other questions that you would have. If we can't answer it, we'll take your phone numbers and get back with you, make sure we get the right answer, or get it back to Amy.
Just a curiosity question. I did not know that we could do mail order now.
And so I guess where would I have learned?
Oh, so I tell every new hire when they're coming in, so they get it. I don't know what happened prior to me, but anybody that I talk to, I always ask them, if you take anything, blood pressure, thyroid, cholesterol, something that's a daily maintenance drug, to always do the mail order where you pay for the 1 month and you get the 2 months for free. Now, you cannot do that currently with every drug that you have. So, sometimes you can go to your pharmacy if the doctor writes a 90-day supply, and you may be able to get a blood pressure or a thyroid pill filled for 90 days. Some of them you cannot because of the cost of the drug. But if you do the mail order, you can always, unless it's a narcotic or something that's a specialty, you can always get a 90-day supply.
It starts with your doctor and then.
Starts with the doctor. So when you go in and they ask you for your refill at your annual physical, and they need any meds, I need meds. So it's funny because all the years that I've done this, 24 years, I never did the mail order. My husband does the mail order. I didn't do the mail order. I made him go to the pharmacy and pick it up because he's out and about during the day. I just went for my physical last month, and I said, let's do Express Scripts. I went on a Thursday. I had my meds, it was either Monday night or Tuesday. So it was like, boom. She just typed it in and away it went, and in the mailbox they came. Now they will come in, I always laugh because they probably use one bottle fits all, because it's like this tall and this big round, and you may only have this many pills in it, but it's, I guess for the horse pills, they all fit in there for 90 days. So maybe that's the reasoning. We order bulk of those bottles, but yeah, it works really great.
But the doctor's office actually is the one that you don't get a written prescription and mail it in, they
Nope.
do it?
It's really easy. When you go in, you just tell them, send it to Express Scripts. And I was amazed myself at how fast, because I was almost out of the one. I thought, and yeah, boom. Monday or Tuesday after my Thursday AM appointment, it was at the house.
You know when you go to the doctor now, they say, oh, who's your pharmacy? What's your pharmacy name? Because they're gonna eat, I don't know what they call it, e-subscribe.
Right.
That's what they're doing. They're sending it, they don't, notice you don't get a hard copy prescription anymore, unless you're old school like me and demand one, but you never see it, just goes and you get a little ping on your phone, your prescription's ready, or it arrives at your house.
Now, if it's an antibiotic or something that you need right away, obviously take the prescription and go to Walgreens and get it filled. But you're just your regular, everyday blood pressure, thyroid thing, send it into Express Scripts. You're gonna save money. Yes.
I get in, so I can do Express Scripts, and it's 90 days.
Yes.
Will I still get that?
Sure will. Yeah.
Cool. Now remember.
And that's a really good question. It was.
Yep, it comes in a cooler with the dry ice in there. Yeah.
She said she gets insulin 90 days through Express Scripts. Will I be able to do the same here? And the answer is yes. So if you didn't know about the mail order benefit under your plan, I'm really glad that you had an opportunity to kind of talk about that.
Now you guys remember, before we're gonna leave prescriptions, so remember Michelle is back there, waiting for you, to help us help you today. So if you have concerns, today is a great day to get them out to her.
So we went through that.
Okay, I think we're getting back to the prior authorization, right? So, these are some terms that you'll hear when you talk about prescription drug plans. Prior authorization, step therapy, and quantity limits. So prior authorization, what that is that is something that your provider does with your medical file to make sure that there's a complete safety and effectiveness of the drugs that are reviewed before putting you onto something that, maybe is newer to the market or may not be the appropriate prescription for that for your particular condition. So prior authorization, they work with the plan to get that. It's not really anything you need to do, but they may say, hey, I can't get this filled, or I can't write it because I'm waiting on prior authorization. They have to make sure that they contact the plan. Step therapy, this is really kind of out of order because first you do step therapy where we require you to do one drug to treat your medical condition before we do another. Many plans have that right now. So you do step therapy. If that drug doesn't work for you, then they get a prior authorization to go on to the next. There's lots of cool things that we can do with the prescription drugs in the Medicare plan that's being offered to you. We're gonna get to that in a minute. Quantity limits is just simply, again, we're talking about it may not be effective to give you a 30-day supply when we know that that the medicine itself will actually degrade and not be effective after 15 days. So there may be quantity limits on certain prescriptions that are in the plan. That's all listed. We're gonna go to the next slide. Well, actually, it's the one after that, but we'll talk about this. So during the first 90 days in this plan, you're eligible for a temporary transition fill of your Part D Medicare covered medications. So these things that are items that are on our formulary are subject to a prior authorization. So at the end of the year, you may be like getting ready to renew your prescription drugs under your current plan, or maybe you didn't get a chance to do that. And it comes January 1 and you had done your homework and you looked and you're like, oh, this drug is, I didn't see it on the formulary. And you go and get your refill. We're gonna fill that in the first 90 days of the plan. We'll give you a 31-day supply. And then we're gonna give your provider and you enough time to work through and get us what we can get. It's gonna be a little bit easier because you're on a Blue Cross plan right now with ESI, and we're Blue Cross with ESI, so it'll be a little bit easier. But just to know that it is a benefit. So anything that it has clinical prior authorization or step therapy or formulary quantity limits, we'll give you a transition bill on that. We'll notify your doctor, we'll notify you, so you guys can have those conversations. Yes?
Okay, so with that, he's allergic to certain medications, and we've already tried them and found out he was allergic to it, that's why we're on the meds we're on now. So we're gonna have to repeat that, or will it, the doctor will just have to write that we tried this in the past and we weren't able to, and
So, I would definitely get with Michelle in the back of the room on the exact medication, but her question was, well, we've already gone through that, we know we need to be on this certain medication. So we're gonna have to look really at where it falls on the formulary to see if it even meets that on our formulary. It may be that it doesn't have a prior auth, we don't know until we actually look at the drug. But if it did, we would fill it on the first fill within 90 days of the plan, so January, February, March, we'd give you 31-day supply. We'd send a letter to the doctor who would already have all this medical history, and we'd have to, and we would just post it to this plan to make sure, and then inform you of what your copay would be to continue on that. So what is the term that you use for that? When you call the prior authorization, you also have another term. Can't remember it right now. When they fill it like that. Coverage determination. Thank you. That's what I was thinking of.
Can I add something quickly?
Yeah, she wants to add something too.
Your question, regarding like if you have to, like something requires step therapy, there's a drug, and you're saying it's already been tried and there's an allergy, you would definitely not have to try that drug again. The doctor would say, if the drug that we prefer is not enough for you, for whatever reason that might be, that would not be something we would have to try.
Yeah, so you wouldn't go through step therapy again. Once you do the coverage determination, and we get all of that to say it's okay to fill the next one, because, we know it's this, and that, it gives the authorization number, then it lets it go through.
Yeah, the only thing that you guys have to repeat is just, if on a different plan, you already provided this information, or the doctor has, they would just leave the same and the doctor would just resubmit the same information.
Yeah, prior authorizations do not carry over from one plan to the next. But I don't know if that's a big deal. Ready?
Okay, well, I think it's important that we point out the note. Certain drugs, and I think we touched on this earlier, they may be covered under Part B as in boy benefit, or used to treat certain conditions, those aren't gonna be eligible for a temporary supply and will require a prior authorization. But we've got a list of the Part B later on in this presentation, we're almost to end, so we'll have it there.
Ready?
So here we are, it's the next one. So here's the Part B versus Part D. So in general, Part B medical benefits are drugs that require durable medical equipment, and administration such as albuterol, mifrazma, through a nebulizer or insulin through an infusion pump. So these will be covered under Part B. Immunosuppressive drugs for Medicare covered transplants, certain oral cancer treatments, certain oral drugs for nausea, and certain vaccines, there's a list over there, drugs for kidney failure and drugs administered in the provider's office. So your medical benefits, Part B, will cover pneumonia, influenza, or flu shot, hepatitis B. Please get those in your provider's office. I just told you earlier, I went for my annual physical. I got my flu shot in my provider's office. For Medicare, they wanted me to do the drive-through like they did for the vaccine, COVID vaccine. I'm like, well, but I'm in with the doctor. You know, maybe go and back in there. No, we'll do it in the doctor's office. They were a little mixed up there. So things certainly have changed. Pharmacy, shingles, tetanus, those vaccines, get those at the pharmacy. It's gonna be the best way for you to get those. You could get them in your provider's office, but then you may run into having to file a claim. So this is a nice little handy list to have. It'll be in your member material information as well. So just remember that there are certain drugs that are covered under Part B as in boy benefits and others under Part D.
Question.
Yes.
I now see, so we had a situation with my mom, Part B versus Part D. It was a nebulizer medication.
Was it?
It was.
Yeah.
But my question is, who is responsible for doing the prior authorization? Is that something you have to do?
No.
Or is it supposed to be done with the pharmacist and the doctor?
It's supposed to be done with the provider and the pharmacist or the durable medical equipment supplier. Yeah.
And if there's a delay, contact customer service. They can actually look into that and reach out to the provider to help get it pushed through quicker.
Well,
If you experience a delay,
well, because of the COVID and because of the loss of personnel in a lot of these pharmacies, some of this stuff, like this situation that I ran into with the B versus D, was something that I thought should have been done through the pharmacy. And I was told that I had to do all the contacts. Have the doctor call, have them go to the portal. I mean, all of this stuff that I was telling them to do wasn't working. So it's good to know that that is not my responsibility to be pharmacist. The pharmacist said this is something you should be doing, not me.
Yeah. Well, the doctor should be calling.
Well, the prescription was sent in. This is the thing. She was already on the medication prior to that time. And so they wrote the prescription from the nursing home to the pharmacy for the refill, but they only can give you 30 days. So with the pickup medication, these two nebulizer medications that they said we have to have prior authorization. Okay, come back on Monday. Well, when they come back on Monday, they said they still hadn't gotten that authorization, and I needed to contact the doctor.
Sometimes they do that, they'll engage you in that. I have a diabetic son and he runs into that at the pharmacy too sometimes. And I tell him, I said, no, anything to be doing that, you tell them that. So,
And I think it's because of the personnel shortage, maybe that's what happened, but it actually took me about 4 weeks.
could be different things, yeah, new hires, that kind of stuff.
customer
Okay, we're almost done, but this is kind of like the fun part that we're getting to, and thank you guys for being so patient and going through all of the questions. So, some additional things that we're gonna be bringing to you in the Medicare Advantage plan, our health and well-being programs. So, as you get, when you elect to enroll in this plan, we're gonna make sure that we reward you for, getting an annual physical, getting your flu shot, monitoring your physical health, breast cancer screening, diabetes, eye exam. So you will get notified at us, you know, it may be time for you to do this, and if you do this, we're gonna give you a reward. You know, they could be $10, $15, they do vary, that's why they're in brackets. So if there's two of you that are on this plan, Medicare Advantage, together, and you both get your annual physicals, and maybe the reward is $25, well, you might have $50 to go out to dinner with, so. Very good things, those are some things we like to put the dollars back in your pocket, make sure that you're getting your healthcare checkups, exams at the intervals that, would be appropriate to have you have the best retiree life that you work so hard for.
Well,
Okay, and then coordinated care, so if you are, when you are diagnosed with something that, you know, you don't understand, it's complex, how do I go about treating it? We have a lot of, ways that you can go, and we have a suite, I like to call them, of medical professionals behind the scenes that'll be able to assist you with understanding and coordinating your care. It can be very difficult when you're faced with a surgical intervention, you kind of don't know where you need to go. You have questions, we have a variety of avenues to get those questions answered for you. We also have, if there's something unique, we've done really unique ways to treat, to give you what you need for your medical and health care. We do that through medical directors, pharmacists, dietitians, social workers, behavioral health. We have a team that's really integrated, that's gonna work together to fit whatever need that you guys have.
ready?
Slide 33 is a no on the presentation, so maybe that was that thing that didn't get updated. Okay, so virtual services, Welding, if you are online, get more comfortable with that. We do have a 15-minute weekly webinar that is designed to support you in your well-being journey. We have a 24-hour nurse line. I find this very comfortable. I'll give you a live example. I go with my mom and dad. My dad's all nervous about my mom's health. She's all nervous that he's nervous. Then they give me a list of questions. We all go into the doctor. And then the first question we put on the list, we forget. Then we're all embarrassed, and we don't want to go back to the doctor and waste his time and ask that question. We have a 24-hour nurse line, so you can call and do any of those follow-up questions. So that's a really nice thing to have, because again, it can be a little frustrating when you're in there trying to get all the things answered to questions and things that you never thought you had to ask. And then we have the MyBlue virtual assistant. So if you like to do the chat way to answer your questions, we also have that. So whatever way is most comfortable for you to communicate with us, we have it out there for you. Okay, these are additional welding programs. There'll be more information in your resource guide that you'll get once you enroll. We have advanced care planning, caregiver support, collaborative care, diabetes management, bunch of education services for that, meals delivery. So there are opportunities to have meals delivered to your home, post and inpatient hospital discharge, non-emergency medical transportation. We also have that built into the plan. Online visits we touched on earlier, palliative care, we have resources for that, remote monitoring. We have, those services are embedded in this plan as well, supervised exercise therapy and tobacco cessation. So just a whole host of programs that are available in Medicare Advantage that you may not see in your traditional plans. Yes?
We haven't touched on this, but are hearing aids covered? They were prior.
So the question is hearing aids, so.
There's a hearing benefit, yeah, there's a hearing benefit. We don't have it laid out at the moment, but did you, you didn't receive a packet, right, or you did? You did, I can show you, I'll come over in a few.
It's the same.
It is the same, that I remember, or I can say I know for sure, but I was gonna show you where you'll find it.
So it's $1, usually it's $1 amount, right?
I think 2,500, 2,700-ish, right?
Yeah.
Up to, yep.
So it's $2,500 shoot, we should have put that on the slide. That's a really good question for everybody. Yeah, we do get that quite.
It wasn't bracketed.
So you do have that, yes.
Does this plan include, vision and dental?
Does this plan include vision and dental? The plan itself doesn't include dental and vision. I'm not sure with the County of Berrien group, if you offer dental and vision to retirees, I'm not sure.
We do not, but I think they were going to bring some information. I think Tracy was going to, somebody was going to.
For, online, or like individual,
Yeah, so that you can purchase it separately if you wanted to. So it's usually confusing because I think when you look at a dental vision plan, it also includes prescription drugs, and I've preached to you for years, don't sign up for anything unless you hear from me first, especially with prescription drugs. So this is a dental vision that you can purchase directly, through Blue Cross Blue Shield if you wanted to look into that. We sent you we have the name of the person, so we can pass that along.
The individual plan is what you would be looking
Yep.
for, so.
You'd be paying it on your own. I had a recent retiree, so he and his wife picked it up when he retired in December or July, and I wanna say it was like $90 a month, but he got the top of the plan. So it was $1,000, coverage for each, he and his wife for dental per year, and then, so much on the vision. So that gives you an idea about where. So you can also look at your homeowners, people, that whoever does your homeowners, they may also have some kind of dental vision. Delta Dental is big, Blue Dental, PPO, so it's just some options.
That's a good question, so yeah, because you're seeing it advertised right now. I think we've got about 3 or 4 common enrollment vendors that are like on the channel every day, and I have to hit the mute button when they come on. But yeah, those are individual plans, and when they design those, they do is design them with dental and vision in them. An employer group plan, most of the time it would be, like an add-on, so they don't come standard, it's all on the plan design. And we would, so good question. Let me see, what else do we
I think we have a
have?
question back there.
Do we do? I'm sorry.
What am I getting that I didn't have before?
What are you getting that you didn't have before? At a very high level, I would say this slide. Do we have where's our silver sneaker slide?
It's coming, it's gonna be coming up next, because I was trying to cue Stephanie to see if she was ready to go.
This is where you can access any of those programs or ask for additional help with your medical care. Tracy, you might want to leave it for a minute. People are writing down the number.
Yep.
It's 800-775-2583. If you're a TCY user, it would be 800-240-3050.
Stephanie, are you ready, Stephanie? You're up, I think, shortly.
I think we have a question back there. Yes?
I have one question about prescriptions.
Yes.
I have a medication for my eyes, it's very expensive, but there are several generics that could be used, but do not work on my eyes. When that prescription is turned in, will that be accepted even though there are other generics for that, my condition?
Okay, your best bet is going to be to check with Michelle, and she'll give you the best direction on what's going to happen when you enroll in the plan. Yes.
I guess I missed the answer to one question.
No, she's bringing up silver sneakers. I said what was on that slide was additional, and then silver sneakers. I'm sorry. Yes, we're gonna go through silver sneakers, which is additional as well. And she's coming up right now.
We had to put it underneath this slide because you're gonna contact Silver Sneakers direct if you have any questions on that. Do you have a question, ma'am?
So, I'm not 65 until the middle of next year. My husband, yes, what happens with me during this time until Medicare extended cutoff?
So her question is, my husband's 65, he's gonna be in the Medicare plan. I am not going to age up into that plan until the middle of next year. So you would have, you guys offer pre-65, right? Pre-65 coverage. So you would remain in the pre-65 plan. You would still use your same identification card. He's gonna get a new one if he enrolls in the Medicare Advantage plan. So he would use his Medicare Advantage plan ID, you would use yours. You would sign up for Part B as a boy to let them know, you have a 7-month window. I suggest, starting with 3 months before.
I send a letter.
Yeah.
All my
She sends a
retirees
letter.
that will be 65, you get a letter 3 or 4 months ahead.
And then you sign up for the Part B and you get that information over to Amy and then Amy will be able to enroll you. Send you out the information. Okay, we're gonna get to your information here right now.
Oh, I see.
In regards to
Well, here,
what else
we'll bring her
am I
up
gonna
first.
get?
We're gonna bring her up first because this is a good break.
Who wants to stand up for a second or move your arms around?
Are you sitting?
Who knows about Silver Sneakers? Has anybody heard of it before? Fantastic, a little bit. Well, Silver Sneakers is a plan benefit. We're in partnership with Blue Cross Blue Shield and with fitness. 15,000 facilities in the country that participate. So what that means for you is that you get to go to all 15,000 of them if you want for free. And you can do anything you like. You can go as much or as little as you like. You can take classes.
Thank God.
You can do things online. You can go swimming, you can walk the track, you name it, keeping you active, healthy, and living your best life. That's what Silver Sneakers is all about.
But the key is, I looked it up and I don't think I found anybody in our area.
Okay,
Like who?
come see me. I've got it all ready to go. I can type in your zip code. I can look for classes. I can look for
So there are
facilities.
people in Berrien County?
Oh, yeah, for sure.
Okay, for sure, okay.
Yeah, there are a lot of facilities in the general area. It kind of depends on where you live and where you want to travel to. Weather like today, I'm happy to travel a little farther. Weather, I don't know if did y'all have frost and everything and little snowflakes coming through yesterday? Then I was starting to think about maybe I want to take a class online. There's Silver Sneakers Go on demand. You can also do live classes. So, technology is really wonderful. You can do it in your tablet, your iPad, your computer. Have your smart TV and have things on there as well. So you just go to your classes. I taught a Silver Sneakers class right before I came here to be with you.
Hazel says, get on the road.
Questions on Silver Sneakers and this is a fitness benefit.
Silver Sneakers is it? We're all over 60. Silver Sneakers, we pay.
Hey now. I'm a fitness instructor too, and you gotta keep moving even if you're walking.
Or you turn into the Tin Man.
I've taught chair aerobics and it is so fun. I have so much fun teaching aerobics on a chair and yoga.
Not 60, the system.
I'm closer than you think.
Well, what's lovely is, fitness is not for a certain age. Fitness should be a lifestyle, healthy, moving. It doesn't have to be taking a class.
But that's it, it's Silver Sneakers.
Silver Sneakers is a fitness benefit to keep you
But that's
active
it,
and
that's the
moving.
only benefit we're getting.
No, there's other benefits. There's programs you can look into. Just by enrolling in the Silver Sneakers, they'll have like some programs like nutrition. There's a whole bunch of different things that Silver Sneakers offers.
Did you want to tell them about the college tuition?
Yes, yeah, if anybody have kids that have grandchildren that might be getting ready to go into college?
We all have great grandchildren.
Awesome.
How are you blessed?
I wanted to start off as a great grandparent or grandparent. But with the Silver Sneakers membership, there are participating colleges that for your visits, when you go and use your fitness benefit, that money is put into a college fund and you can earn up to $1,000 per year for your kid to go to, or your grandkid, great grandkid to be able to go to school. Yeah, so that's something that just started a few years ago and it's really great. Have information in the back, and I can look up, whether you want to know where classes are, what facilities are around, and I'm not sure who it was that goes to 4 different states.
She's right there.
Yep. Great, and I'm happy to go with you as well. But you can go all over the country, so this is a benefit that follows you, just like you have your coverage. You also can stay active and healthy no matter where you are going.
Mhm.
And I know Amy, Abby, who usually comes, she works with Abby, and she always gives us examples. She ran into a gentleman, and he never really exercised until he retired, and then, he found out about the silver sneakers, and now regularly goes. He'll go to one facility to use the hot tub, goes to another facility to use the swimming pool. And this is like all in the same day.
Right.
Goes to another facility that he likes to actually live walk the track. So, and he's made friends throughout all of that. So it really is a nice thing.
Yeah.
And, the college tuition discount program is good for you to use that online. I want to address your concern though about other things that are in the program. I think all of the wellness and care management, the excellent customer service that we bring you, the ability to mirror a lot of the copays in your current design, so we're not all, having a total disruption on this through a new plan that's being offered to you. I think those are some of the things, and I hope that we did a good enough job to introduce that to you. Our rewards, mailing you out, making sure that as you are using the services, you essentially are getting paid for it. We're sending you gift cards, letting you know how we're partnering with you to help understand and continue to manage your health. I think those are some of the really nice things about our Medicare Advantage plan, that we're not just in it to pay a claim and then, give you the customer service the way we approach our member servicing through providers and members being on the same team. So I reach out to both of them for you. I think that's unique. I think welcoming you to the plan, just to making sure that we're touching in and saying, do you understand? Do you have any questions? Do you want me to look up your doctors? Do you want me to go over your medications again? I think those are extra value that we bring to you in Medicare Advantage as well. So,
Being proactive with your health and having an advocate, somebody that's with you, watching over you, resource for you.
So when somebody calls you from Blue Cross Blue Shield of Michigan, it's not spam.
Well, sometimes it is.
But you know what, though? Just because, how sometimes you'll call and they'll say, what's your date of birth? What's your address? What's this? And basically, what's your blood type? You can do that right back to Blue Cross if they call you. Where are you calling from? What company did I work for? And you can actually qualify them as a true caller if you wanted to. So feel free to ask some questions.
And I just want to say, if we shall have the privilege of having you select us and enroll in the plan, when you do get the material and that health questionnaire comes out, please, I know Tracy said it's optional, but I have a different opinion. I think it's very, very important, because when you return that, it helps you have a discussion with your providers about the items on the form. It helps us really give you the information that you need that's important to you, because I'm not sure what all the questions are on the form, but if it says, are you worried about your high blood sugar, we would probably send you stuff on information on that. We're not gonna send you something on heart disease if a question that's on there about heart disease, you say, no, I don't have anything. So our intent is not to clog up your mailboxes or your phone lines. Our intent really is to really give you exactly what's important to you. There's a lot of information out in this world, and we understand if you get too much, then it becomes overwhelming. We want to make sure we're getting you the right information at the right time, so you can have the right health care when you need it.
Yeah, our job is to help you. These services, these programs are to better you and help you be a little more at ease.
So that's
Any other questions on silver sneakers?
Oh, no.
Right. All right, well,
You guys are good. You guys are good.
I just have
So
to say
is
too,
it.
you talk about that's pretty common too for people that go from one place to another. I have people that come take my class that were just somewhere else or whatever. But I have had a lot of strong friendships that have come together out of Silver Sneakers and coming together as a community. Fitness, fun, and friends, and then we throw in food too, because we do a lot of socializing and things like that. We had friends go together on vacations. I've had a couple people get married. It's kind of fun.
Oh, really? Wow, that's cool.
Yeah, it actually is.
Okay, anybody that's learned the dating again, Silver Sneakers, there we go. Okay, are we done? I think we're towards the end of our cycle.
Yeah, I think we are.
They've been very patient.
Customer service.
So here's our customer service. I want to thank you for coming, very much. Yes, we have one more question.
Is this a one-time option? If I happen to not opt in, will there be a window next year to reconsider? Or
I
is it
have to
one
have
and
Amy
Amy,
answer that.
Okay.
She's talking. Her question was, is this a one-time thing or will I be able to have an opportunity to enroll next year? If I don't-
So, yeah, it's not gonna be as big as this, so you could contact me, and yes, you could enroll next year. But,
Or
no,
can you opt out? If I don't like it, can I?
so when you roll over, you will stay on that plan. So,
Good question. Yes.
I've got a question about the prescription drugs. Currently, having both Medicare and Blue Cross. When I hit my $1,250 copay max with Medicare, and I generally do that like June, from that point on, everything is free. This says that we have a separate, it was over $7,050.
No, that's the catastrophic limit. That's the catastrophic.
I think that she's-
He sits behind it on Part B plan.
I think she's
Yeah.
looking at that standard language page,
Yeah,
that standard language page. We can explain that offline, or,
yeah. If you want to, Michelle can help walk you through that a little bit better. But that's remember the Part D plan is for all Medicare beneficiaries and all of the Medicare Advantage plans that offer Part D get to follow kind of like a government setup is the standard design. So it had different phases, but under your group plan, you do not have any of those phases. But they still list the information in there in case you reach catastrophic, which catastrophic then you have like that $9.85 if you get 22 if you're on there. But most of the people, it's individual plans. It's that it's 95 in there and 5% or greater. And then for catastrophic, this is for a good plan, it's 95 there, 5%. But never more than plans copay. So what we get on the side is yes.
It mentions here that you have a contract with the federal government.
Yes.
How many years have you
Oh my gosh, how many years have we been there?
had with this PPO?
For this PPO, well, I've been there, I just got it back for 10 years. And I think it was, the Medicare Advantage PPO, that would have been 2 years, 2009, 2008. So, probably 12 years. And then, remember the government kind of flipped back, they were kind of like Medicare Advantage plans and fee for service. We've actually been in the Medicare, business even longer than that. I've been here since like 2000. Every year they come back. Yeah.
We're getting now.
Okay, so, yeah, so you're getting additional benefits. You're getting benefits that are, there's some to look at your benefits. Additional things that they put in there, I wasn't that close to the things. I can't answer that directly. Tracy's